Initially was leaning towards a research career, and I had done a PhD in cancer research, essentially focusing on pharmacology or development of new drugs, specifically focused on cancer and oncology. That's what drew me to oncology in general as a field, and that's why I decided to go back into internal medicine and do my medicine training and my oncology training after that. My focus primarily is on gastrointestinal malignancies and melanoma. So I treat quite a bit of colorectal cancers, pancreatic cancers, gastric cancers, esophageal cancers, and other cancers of the gastrointestinal tract. I also run the melanoma clinic at the Lemon Holton Cancer Pavilion. So these are my two main areas of specialty. Cancer hematology is a fairly large practice. We're a group of about 17 physicians that allows us to focus on specific disease subtypes and allows us to specialize within those disease subsets. So, you know, we're not generalist oncologists per se, but we focus on specific subsets of oncology that allow us to become subspecialists within that field. Also, being a large practice, it allows us the mobility to go to patients, to go to facilities closer to patients' home, and allows us to deliver care close to their homes. We have multiple satellite clinics that we go to and provide care close to patients' home. It also gives us the patient base to be able to develop good clinical trial programs and make those new drugs available to patients prior to FDA approval close to home. There has been a lot of exciting new drugs that have come out over the last 2 to 3 years, both in melanoma and in colon cancer in general. Metastatic melanoma, which used to be a death sentence essentially with life expectancy less than a year, has seen an explosion of new drugs come out which have tremendously affected the life expectancy of these patients. There's new drugs that have extended the lifespan considerably for a lot of these metastatic melanoma patients, and about 20% of these melanoma patients who are treated with immunotherapy these days are living very long periods of time, up to 4 or 5 years essentially. So that has made a tremendous impact on the lives of these patients with metastatic melanoma. There's also been quite a few targeted therapy drugs that have come out in colon cancer, and we find that the life expectancy of these patients with metastatic colon cancer also continues to increase compared to historical numbers. So there's been a lot of excitement with the new drugs that have come out in both of these cancers.